labs are hard at work trying to keep up with demand. For more, I'm joined live by Michelle Hoad, CEO of the Medical Laboratory Professionals Association of Ontario. Michelle, good to have you on again.
Hi, Lena.
We know millions of rapid tests have been purchased by the government. So let's just check in here. How many tests have been used so far, and where have they been going?
So what we understand at this point is over 600,000 have been deployed. So we've got 2 tests right now that are live, ID Now and MLPAO, both being used a little bit differently, but we have them in long-term care homes. We have an employer pilot program that's currently happening. So a lot of areas that are using these 2 rapid tests to get results fairly quickly.
We were just talking about the Spartan rapid test, made in Canada, approved by Health Canada. It was recalled. It's back on the market now. What are your thoughts so far? And what do you make of this new rapid test?
I think it'll definitely help us. I think we're always looking for more tools to help us. So I think until we actually see it in action, we can respond. The reason I say that is because at the onset, when we received these 2 rapid tests that we're using now, we were trying to understand how would they get rolled out in Ontario. And what we have found is that they're not as easily as we thought the rollout could be. So for example, the perfect scenario we have right now is that you would have a rapid test instrument that would sit in one of our labs. And what would happen is at the assessment center, you get swabbed by a healthcare worker. It would go to a lab, and it would actually be the rapid test instrument is in a lab. That is one of the situations. But we also have these instruments sitting in assessment centers in communities up north, Indigenous population areas where there isn't a lab, where a doctor oversees it. So we actually have a hybrid solution right now of how these rapid tests are being used. So until the Spartan Cube comes on and we actually see how it works, we can't really respond quite yet.
I was going to ask you how these rapid tests have helped labs in Ontario, whether they have eased the burden at all. And it's been kind of interesting to hear you talk about the challenges.
Yeah, it's a really good question. So it's hard to answer because the answer is yes and no. So yes, because where we, northern parts of our province where you would have to wait days and days to get results, we now have these great little machines that sit up there. A nurse can swab you, and with the oversight of a doctor, you're going to know really quickly. And then we have other, situations where they're actually sitting in our lab. So our lab people are still involved in these tests. So I think a lot of people thought originally it was going to be like a home pregnancy test. So you take it, you're going to find out really quickly and look at the results. That's not at all how they work. And so we thought, great, it was going to save, potentially millions of tests going into our lab. That is not the case either. We still need a human to actually run the instrument.
Okay, good to have you on to kind of explain this. We have been talking about new COVID-19 variants popping up all over the world, and a really concerning situation in Barrie where the UK variant has been detected at a long-term care home there. I want to get your perspective on this. How do you even test for these new variants? And there's so many of them now.
So that testing for the variant is very specialized. That's a really great question because a lot of people think, does it just go into the lab and the lab actually discovers it? What it happens is it goes through the PCR instrument, and there's going to be a value that shows up that it looks like it's off and something's different. That actually now travels to a research lab where there's experts looking for this variant. So this week there was a lot of work being done with that. So the fact that they've actually discovered it is tremendous. So now we've just got to sort of track it and see exactly where it is, which is what they're doing right now.
Okay, Michelle Hoad, thanks so much for the conversation. As always, we appreciate your insight.
Have a great day.
Talk soon. Thanks so much, Michelle.